So today I will tell you the dangerous side effects of Cosome-E Cough Syrup. I'm your pharmacist Dr. Abdur Rafy. I'm doctor of pharmacy. I have a specialty in pharmacy. I'm a drug expert and you're watching Rafy Healthcare channel. So let's start. Its brand name is Cosome-E and its generic active pharmaceutical ingredients are ammonium chloride, diphenhydramine hydrochloride and aminophylline. It's a cough syrup used to treat productive cough. It's a 120 ml and its manufacturer is Martindale. So today I will tell you about its dangerous side effects. So let's start. I'm taking out its leaflet. This is the leaflet and this is the bottle of this cough syrup. So this is the bottle and this is the leaflet of it. There are three medicines in this cough syrup: ammonium chloride, which is a expectorant; diphenhydramine hydrochloride, it's an antihistamine used to treat allergies; aminophylline is a bronchodilator, it helps patient to breathe as it relaxes the bronchioles muscles. So these are the adverse effects today I'll discuss. So let's start. The first one is psychomotor skills impairment. This cough syrup, the Cosome-E, has these three medicines: ammonium chloride, diphenhydramine and aminophylline. So these can cause these side effects like psychomotor skill impairment. These are the normal skills or normal functions or normal chores or daily, you can say daily functions, daily chores which persons do. It can impair it. It can also cause ataxia, sedation, drowsiness, disturbance in attention. The patient has difficulty in attention and also in concentrating. The patient also gets unsteady. It also causes dizziness, headache, which is the pain in head, short-term memory loss. The patient can also have memory loss problems, difficulty concentration, blurred vision, photophobia. Photophobia is the fear to the light. Usually the patient who is using this medicine avoids the light. It can also cause mydriasis, sinus tachycardia and also thickens the bronchial secretion also. It can also cause tachypnea and dry mouth also. Moreover, it also causes gastrointestinal disturbance including gastroesophageal reflux, in which the patient has reverse fluid in his mouth or the food. The patient complains that she is having reflux of food or any watery kind of juice that's very spicy like. It comes in their mouth and means it causes reflux. Okay, it also causes nausea, which is the feeling of vomiting also, and hematemesis, which is the blood in the vomiting. It can also cause diarrhea and constipation too. Diarrhea and constipation both are present here. This is due to, as some patient may feel diarrhea and some may have constipation. Okay, it can also cause urinary difficulty. The patient may have difficulty in urination and also it can also cause urinary retention too. Polyuria too means the patient has to urinate a number of times in a day. Albuminuria means it also excrete albumin, which is an important protein. The patient can also get fatigue too using it. Another side effect of this cough syrup is also that, which is a general side effect, that it can cause sedation and difficulty in concentration. So that's why usually the patient who are using these cough syrups are advised not to drive or operate heavy machinery because they can cause sedation and difficulty in concentration on and also psychomotor skill impairment. Because of that, the patients are advised that not to drive or operate heavy machinery or do complex works, okay, or decision making. So that's why these are the side effects. And if I tell you about the overdose, it also has overdose side effects too. Diphenhydramine can cause convulsions, coma, mydriasis, fever, flushing, drowsiness, dizziness, diarrhea, and also pain in the abdomen, hematemesis, which I have already told you that is the blood in the vomiting, agitation, the patient may agitate. It can also cause tremor, dystonic reactions, and hallucination. Hallucination are those things which are not in reality, but the patient may see or hear it and may hallucinate, okay. They are also saying that some patients have an allergic reactions from diphenhydramine, which are very dangerous in the form of hives, okay. These are dangerous. Overdose usually is managed by gastric lavage and aspiration. Diazepam is given for the management of seizures, and physostigmine is given for the anticholinergic effects. It stops the anticholinergic effect of diphenhydramine, okay. So these are the overdosage side effects which occur due to the dose. As the dose increases, these side effects intensifies and becomes more dangerous, okay. That's why we always says to the patient that consult your physician and pharmacist before using these kind of medicines, because these are the medicine. This is not a food, it's a medicine. So you should use it like a medicine, okay. You should not just use it like a food, that what side effect will it have. It has a lot of side effects. If you see here, they have also mentioned to be sold on the prescription of a registered medical practitioner only. That's why you should take a note. So I hope you found this video informative. Don't forget to subscribe my channel and also like and share my video too. If you have any question regarding this medicine or any kind of medicine, you can drop in the comment section. I will reply you. And now take care of yourself, and always remember your pharmacist Dr. Abdur Rafy in your prayers. Allah Hafiz and take care.